Now, I'm going to show you some of our patients, not all of them. We have now done 7 face transplants. We've done 2 bilateral hand transplants. We're actually the leading center in the world right now with the number of patients, as well as different types of patients. No one has done both. There are teams that do one or the other, but nobody has done both. But I think it's important for you to see some of these pictures, because otherwise it's hard to really understand what we're trying to do. So these are, at the time of injury, patients: Jim, Dallas, Mitch, Charla. I don't have the original injury from Derek, one of our last patients. And they had various types of injuries. Jim, at the picture actually shown, had a high voltage electrical injury. The entire midface was burned out. So this, what you're looking at, is really a hole in the middle of the face. Now at that point, I've already put a little skin grabs, and there are areas that are already healing. But that's sort of the extent. No upper jaw, no nose, no midface, no skin. Dallas had a high voltage electrical injury when he was painting a church. He sort of was the only one who could get in the cherry picker, and as he got closer to the high voltage lines, it arced and burned off his face. Mitch got in a car accident, crashed into a telephone pole, and as he got out of the car to help his girlfriend, he stepped on a wire that fell on the ground, and it burned off his leg, but also his face. And then finally, Charla is a well-known patient that was attacked by a chimpanzee locally in Connecticut. So after the conventional reconstruction, this is how these patients were living for a variable amount of time. Now, you may say that Jim, well, you know, from this view, okay, well, it doesn't look great, but there's no gaping wound. He's able to some extent, breathe. What you can't quite appreciate is that this soft tissue that was laid in just to separate the nose and mouth, and it goes all the way where the hard palate should be in the mouth, all the way to the back of his throat. It's not hard palate, so it keeps flopping up and down. He was talking like you would have something in full mouth all the time. It was impossible to understand. Kids, he lives near school, kids were asking him whether he's human or a robot. I mean, he's been going through difficult times. And on top of all that, he has a beautiful daughter that worked at Brigham and Women's Hospital. Dallas's case was awarded the best case and best save of the year by the American Society for Plastic Surgery. And you can see the essentially horrendous result. I mean, again, he doesn't have open wounds, but it's only the muscles from his back that were brought over to cover the exposed bone and then skin graft over that. So there's nothing that resembles even a human face, and Dallas himself has had a 2 or 3-year-old daughter at that time. Mitch got reconstructed in various ways and ended up having distant flaps, and it's one of the perhaps somewhat illustrating example of how distant tissues just look very different on the face. You can see the lower lip and chin hanging sort of bulb of soft tissue, which really doesn't look very pretty, but it was an effort to add more tissue to the lips so that he can somewhat function. But he was not able to close his lips, and he wore nasal prosthesis to cover that hole. It was sort of a glue-on prosthesis that he absolutely hated. And Charla has what appears to be a nose, but it's actually, again, just a flap of soft tissue that has little dimples made in to look like nostrils, but there is no functional airway. She had a tracheostomy, which is a sort of opening in the neck so that she could breathe through that, and she has no lips, so she had a tiny opening so that she could feed herself to some extent, but needed feeding tube to get adequate nutrients. And Derek was kind of pasted together from the remnants of the face that were there, but you can see he's got, at the time when we met him, exposed plate in the lower jaw. He's got more than half of the nose missing, and again, if you would see them from the side, you would see the concavity of the face. So this is them after the transplantation, and even though none of them is perfectly looking normal, I think it's far better than what would one be able to achieve with conventional reconstruction. Derek on this picture is only a couple of months after his transplantation, because it was a relatively recent one. But all the other patients are several years later, and you can see that they all developed a tone in the muscles of the face. You can see the nasolabial folds that have formed, the little wrinkles and lines on the face that are a sign of functioning, contracting muscles when patients are smiling and moving the face. And finally, Carmen, that had this horrendous injury that I've described to you before. She undergone transplant with the early appearance like this, gradually regaining control of her lips, as well as, to some extent, eyelids as well.